Good morning. Welcome to this first course, Pharmacy Vocabulary and Prescription Processing. Pharmacy professionals rely on a specialized vocabulary to communicate effectively in their practice. This section introduces the specific terminology used in pharmacy setting, covering essential terms related to medication, dosages, drug interaction, and more. Starting by medication terminology, understanding medication terminology is fundamental in pharmacy. Key terms include generic name, this one, generic name, the official non-branded name of a drug, brand name, the brand name, the trademarked name given to a drug by a manufacturer, dosage form, this one is capsule, here. Dosage form, the physical form of a medication, capsule, liquid, etc. Route of administration, how a medication is taken or given, oral, this one is oral, topical, intravenous, etc. Strength, the concentration or potency of a medication, dosage, the amount of medication to be taken at one time. Dosage and drug interaction, knowledge of dosages and potential drugs interaction is crucial. Key terms include, first, frequency. Frequency is how often a medication should be taken. Duration is the length of time medication should be taken. Contraindication, a situation where a drug should be not used. Adverse effect, when two drugs interact to produce a greater adverse effect is unwanted or harmful reaction to a medication. Synergistic effect, when two drugs interact to produce a greater effect. Antagonistic effect, when two drugs interact to reduce each other's effect. Method for interpreting and processing prescription. Interpreting and processing medical prescriptions accurately is a core skill for pharmacy professionals. These sections cover method for interpreting prescriptions and steps involved in processing them effectively. The components of a prescription, we have the prescriber information, the name and the contact details of the prescriber, patient information, his name, date of birth, medication details, name, strength, and dosage instruction. Here is the medication details, prescriber signature and date. Interpreting prescription. Interpreting prescription involves reading and understanding prescriber handwriting, identifying patient and medication details, ensuring accuracy in dosage, frequency, and duration. So, prescription processing steps. Here we have the different steps. It include processing and prescription include, first, data entry into the pharmacy system, drug utilization review for safety, medication preparation and labeling, patient counseling and medication use, final check by pharmacist before dispensing. So, to enhance the vocabulary, recommended resources are, first, medical dictionaries and references books for pharmacy terminology, online courses and webinars on prescription processing, practice exercise and quiz for reinforcing vocabulary, and continuing education program for pharmacy professionals like this one. So here we have an example of a case where a customer goes to a pharmacy to get his medicines. So we will learn it together. The pharmacist: good morning, how can I help you? The consumer: good morning, I have the prescription. Let me see. Okay, I think I have it. Let me get that for you. Here you go. Oh, thank God, you are the fifth pharmacist that I have asked for it today. I am glad that we can help you. Thank you. And can you tell me how I should use it? Certainly, you need to take these pills once a day before you go to sleep. Okay, how long do I need to take them for? 10 days for this one. It's important that you finish all the package. If you forget to take it at night, you need to take it too in the morning. Okay, is it safe to take with aspirin? No, you cannot take aspirin while you are on this. No painkiller allowed. I see. Are there any side effects? Rare, but possible. Drowsiness, dizziness, blurred vision, upset stomach, nausea, nervousness, constipation. It's recommended that you avoid physical demanding activities after taking this. Also, no driving. Oh, now I see why I should take it before I go to sleep. Exactly. Well, okay, then can I pay with my card? Sure, that will be $40. Is there anything else I can help you with? No, that would be all, thank you. You are welcome. Here is your receipt. Thank you for your help. Have a good day. Thank you. Thank you. So, we move now to direct and indirect speech. In the previous slide, it was direct speech. It's a conversation. Here we have the example. I call you tomorrow. This is a direct speech between two persons. And indirect speech, she is telling after a few days, he said that he would call me the next day. So, taking our example of the conversation between the customer and the pharmacist, the customer said, okay, it's safe to take with aspirin. No, you cannot take aspirin while you are on this. No painkiller allowed. Transform those two. We will transform those two phrases. The customer asked if it was safe to take with aspirin. The pharmacist replied that no, the customer could not take aspirin. Okay, so this is the two forms. Let's see together the different rules of the direct indirect speech. Rule number 1, remove the comma and use that. So, while changing direct speech into indirect speech, we will remove inverted comma and use that instead of the comma. So, example, we have Raoul says there are 8 planes. Raoul says that there are 8 planes, and we removed the comma. Rule number 2, change in tense. When the reporting verb is in the past tense, then reported speech will be changed into past tense in indirect speech. She said, I will go. So we will transform will in the past. She said that she would. Will become would. She said that she would go. So here the different times, the simple present became simple past, present continuous, past continuous, the present perfect will become past perfect, present perfect continuous became past perfect continuous, simple past, past perfect, past continuous, past perfect continuous, will became would, may, made, can, could, shall, should. Rule number 3, change the pronoun. So the pronoun or the subject of the reported speech is changed according to the subject or the pronoun of the reporting verb, the first part of the sentence. So the possessive pronoun, his, her, mine, are also changed sometimes according to the personal or object pronoun. The example, he said, I eat an apple. He said that he ate an apple. So we remove the commas, one, then we change the tense, the time from present to past, eat, ate, and we have the changing of the pronoun I became he. So in the direct speech we have today, it became that day in indirect speech. Tomorrow became next day or the following day. Yesterday become previous day, now, then. Tonight, that night. Yesterday night, previous night. Tomorrow night, the following night. And here became there. Rule number 5, interrogative sentences. No conjunction is used. If a sentence in direct speech starts with a question word like what, where, when, as the word question word itself acts as a conjunction. So, the example, we have, where are you going? Asked the boy. The boy asked where I was going. So, we remove the comma, 1, we change the time, 2, are became was, we change the pronoun, are you going, I was going, and where it's like conjunction here, and we have are you going, are you, and we have I was, are you, I was going. So this is it. Rule number 6, yes, no interrogative sentences. If a direct speech sentence starts with an auxiliary verb helping verb, the joining clause will be changed into if or whether. So, the example, he asked me, do you come with me? He inquired whether, we can use whether or if. So, he inquired whether I am coming with him. Or he inquired if I am coming with him. So thank you for attention. That was the first lesson. Thank you.